from the hip area, um, the heels, right, wherever the patient's that's immobile has pressure applied to it. With stasis dermatitis, this tends to be on the tibia and ankle. So it's really hard to apply pressure to like your shins or ankles. So that's usually how they know the difference between pressure ulcers and stasis ulcers. Besides the fact that, um, and then the dermatitis, this is the one that's dandruff. So as I mentioned, this one can extend from the scalp to the eyebrows, eyelids, and I showed you some of those pictures. All right, so treatment is going to vary depending on which one of those is an issue. Corticosteroids do help. And then mainly we want, which means having itching, they should avoid hot baths, and they should be bathing in cool water. They should not be using any abrasive soaps on their body, so they should be using very mild soaps on their skin and not adding any extra anything that has alcohol. So basically anything with fragrance. So laundry soaps, lotions, regular soaps, they should be trying to use the fragrance-free stuff, because fragrance contains alcohol, so that further dries and irritates the skin. And then moving on to the acne, we talked about that one. Acne rosacea was the one where you had the rosy red cheeks with a little bit of spider veins in it. That's more of an adult type of acne, and it's not really as severe as vulgaris. It's mainly the redness. And then there are some things that can make these worse. So anything that causes facial flushing, which includes teas, coffees, alcohol, especially wine, caffeine-containing foods, spicy foods, sunlight, emotional stress can cause flare-ups. And then the acne vulgaris is more of your teenager type of acne. So it usually kicks in with the increase of sex hormones. And dead skin cells is what causes the issues. Let me know if I break up, because it looks like I'm having unstable internet. All right, so then that can cause a bacterial infection. This is key to note here, because this can be treated with antibiotics, because the bacterial infection is what causes the pustules. I highlighted this because it is not due to uncleanliness or poor personal hygiene. The reason why I highlighted this is because excessive washing of the skin and all that can also be a trigger for this one, because people feel like, oh, it's because my face is too greasy, and they just like are repeatedly washing their face and applying a bunch of different ointments, and that could sometimes make things worse. There's tons of research out there that link diets, and it's because of dairy, it's because of this, it's because of chocolate, or blah blah, but there is no research that says that that is true. All right, so I highlighted these separately. Acne rosacea, you basically avoid the triggers as mentioned above. It was coffee, caffeine-containing things, and etc. So you try to avoid those, and then they can use a topical antibiotic to treat it, or retinoid, and sometimes oral antibiotics depending on how severe it is. And then same thing down here, acne vulgaris. This is a mild non-inflammatory type, and then the inflammatory type is at the bottom. So acne vulgaris is just going to be treated by the same thing, the retinoid. So the same thing as rosacea. So the retinoid, or the retin A, that helps a lot with the papular and pustular problems. They should use it once or twice a day. And then benzoyl peroxide is the most commonly used topical clean, like face wash. And then there's also salicylic acid that can be prescribed topically. This one is usually available only by prescription. And then we talked about this Veltin gel, which is expensive. And then you know what? I don't remember how much it was, but I feel like at one point I found out that it was like $300 or something for like a little tube, but I don't remember honestly. But it was a few $100s. It might have been like $200 or $300. All right, so this is why I said that it was key to know about the antibiotics. So tetracycline and erythromycin can help with the topical or oral treatment of the bacterial growth from the plug ducts. I mentioned yesterday that tetracycline is a teratogenic, which means that it is contraindicated for pregnancy. There's some other stuff down here. Oh yeah, so isotretinoin is commonly known as Accutane, right? So it's down here in its generic name. And this is the one that I mentioned that They have to be on birth control. You have to monitor their their liver function, because it's super bad for the kidneys. And this is the one that was causing high suicide rates among teens. That's why it's not marketed as much anymore, but it's still prescribed. So this is going to be severe acne, right? Everything up here was mild, and this is severe acne. And I showed you some pictures of what that severe acne would look like. And then we mentioned the photodynamic therapy and the dermabrasion. All right, so the face should be washed gently with mild soap. Like I said, scrubbing the skin using harsh soaps is worse, and this is why I mentioned that we have to emphasize that it is not a hygiene issue, because if it was, you know, obviously we wouldn't have this information, but this makes it worse. And they sell tons of medicated acne washes, etc., tons of products out there. In reality, they might be worse for their skin than just regular mild face soap. So all they need is a mild face soap. That's it. And then, of course, you know, I think this is common sense by now. They shouldn't be squeezing pimples and all that. It shouldn't be, the hands should be kept off the face. Actually, let me highlight that part too. This is key, because you rub oils and dirt into the pores. All right, and then psoriasis, I didn't highlight any. Oh, I did. So then this was psoriasis. Let's see. This is the one that has the scales. So I'll just highlight the definition so you remember what it is. Oh, actually, I'll just highlight this. So it's the silvery white scales, and it's because the skin cells are rapidly dying off. So they should not pick at them, because they will bleed. And I mentioned this already yesterday, that they most often appear on the elbows, knees, and the base of the spine. But obviously, it could appear everywhere. Oh yeah, this too. So I mentioned that. Oops. Sorry. There is psoriatic arthritis. This one is treated with those modifiers, biologic modifiers. So I'm just going to highlight this section. It doesn't mean that somebody who has psoriasis will have this, but it can. So in some cases all the rest is just pathophysiology. So in some cases, you know, they use biologic agents, because this will help with the joint inflammation and the psoriasis rash. So these are commonly used for other conditions, but they can be used for that. So they're commonly used for like arthritis, regular arthritis, but it can work for psoriatic arthritis. So mild cases are treated with the steroid cream. In this case, the sun does help, but of course this is, you know, moderate amounts, because it says up here excessive would make it worse. And then this is the other treatments. So vitamin D, which you can get from the sun, which makes sense. The Kenalog, which is a steroid ointment. Let's see. I'm not even going to highlight that. That's not common. They're more likely to give this medication before they do this TAR and hospitalization. People aren't hospitalized anymore unless they absolutely are dying. So somebody is going to most likely get this treatment in the office as an outpatient procedure, rather than getting this tar bath and shower and whatever. This doesn't happen. So we're going to treat psoriasis with a topical steroid cream, short term, plus some sun, right? Same thing down here. They can have a medication, vitamin D cream. So we're doing a steroid cream and sun for psoriasis that's mild. And for severe psoriasis, we're going to treat it with like methotrexate, or some biological agents such as Remicade, Enbrel, especially more so if they also have arthritis. So they have the rash and the arthritis, they're getting both. For nursing management of this is going to be honestly the same as all skin. So this right here applies to all skin. Eczema, contact dermatitis, and psoriasis. This applies to everything. I guess I'll highlight this here. Oops. So they shouldn't scratch or pick at anything. And then I told you Stevens-Johnson syndrome, extremely rare. I'm just gonna highlight this part right here. This is what I mentioned, that wound care is similar to a burn. Right, so that's all that matters. All that you need to know about this one is that treat them like burn patients. I'm not gonna go too much into that because it's super rare. Bacterial infection, cellulitis is usually caused by staph. What should I say? Whoops. Whoops. Oh. Let me see what's gonna take me back. Sorry. I gotta find my spot again. So what do you guys think so far about the test? Do you guys want it as a homework assignment that's worth only homework points, or would you rather take it next week? Should we do I could do a poll on the, let me see. Where's I could create a poll with them or something. Let me see. I haven't used them in a while, so, breakout rooms. Breakout rooms. Am I the host? I think Ms. Fernandez created this, so I don't think it's gonna let me do it. No, it says I'm the host. But if it's take home, it's gonna be homework points, not test points. I want to make sure you guys are aware of that. Why is it not letting me? Oh. It always has a little option to do polls. They must have removed it. It says I have to log into my Zoom account, so maybe because I'm not logged in. So I see chat, breakout rooms. All right, anyways, so far it sounds like people just want to take it home. Okay, so far it sounds like it might be a take home. Like I said, if it's take home, I could even add questions to it to make it worth more points. I can make it like 50 questions, so you get more homework points for it. But Ford has specifically said we can't do like take home test or Zoom test. They have to be proctored in person. So because of that, I can't give it to you as a test, but I can make it like a test homework assignment, so to speak. I'm also not too concerned because it's cancer, and cancer is not one of your core NCLEX topics. Like I've told you before, NCLEX focuses on some core things. Cancer would never be one. Like they can't ask you questions specifically on like, the patient got diagnosed with squamous cell carcinoma and what is their expected life expectancy, what chemotherapy medications are they going to get. You will never get an NCLEX question like that. What you could get is like, what are risk factors for lung cancer? What are risk factors for skin cancer, right? Like it could give you like a list of patients that says, which of the following patients would benefit from education on skin cancer prevention? And it'll say, so-and-so who's 25 and is a stay-home mom and tans daily, right? Or so-and-so who works in an office blah, blah, blah. And then you pick like that. So NCLEX questions in regards to cancer will be set up like that. There'll be some risk factors in there, some very vague, basic stuff. But because it is a cancer test, I'm not too worried about not being able to thoroughly evaluate how much you know about the topic. So that is definitely an option. Let's see. So let me go back to the book. All right. I'll give you guys a break in a little bit. Let me finish covering. I want to cover all this first. I can always recap on Monday as well before we move on, because we're going to do burns next week. That's why I'm not too stressed about this, because we're doing burns, so I could do a little recap on stuff we don't get through today, and then we can do the next topic. It's all the same chapter, so I'm not too concerned. It's only an issue when we switch completely different body systems. All right, so Stephen Johnson's. So cellulitis can be an infection without any break in the skin, okay? So that one's just, people are not aware of that. You can get cellulitis with intact skin. So, for example, you can have like a spider bite. Well, obviously at some point there was a break in the skin, but you don't have to have a huge wound to have cellulitis. So you could have had like a little spider bite or a mosquito bite, and then, or a pimple, or a, what do you call those hairs that are stuck? Ingrown hair. You can have like an ingrown hair, and then basically you like kind of scratch a little bit, and then it scabs, kind of like heals over, but that bacteria gets into the skin. So notice that this says dermis and not epidermis. So it's not the top layer of the skin that's infected, but the second layer. So it's an infection of the dermis and subcutaneous tissue. So you can have intact skin and have cellulitis. So that's very commonly how you see it. And it's usually like the legs or the arm or whatever. And it's red, it's warm, and it's swollen because it's still an infection and there's still inflammation, right? So that's a common type of cellulitis. But it can also occur as an extension of a skin wound or an ulcer. So a patient has a wound, like a ulcer, pressure ulcer, whatever, a burn, whatever, right? And the bacteria from the wound bed travels down the leg or arm or whatever it is. So the whole arm itself is red and swollen and hot, and that's because they have cellulitis where the bacteria from the wound bed travel through the dermal layer. Okay? Cellulitis, in some cases, can travel from the dermal and subcutaneous tissue to the bone, and that's where it causes your problems where potentially could require like amputation or something more severe. But most cases of cellulitis are just treated with oral antibiotics, if that or nothing. Most of them, some of them resolve on their own, and true cellulitis does require an oral antibiotic. If there is a wound, it could be cultured, because obviously this is caused by staph, and we know that there's resistant staph. So if the patient were to have MRSA that's causing the cellulitis, they would require IV antibiotics in the hospital. But most patients can be treated with oral antibiotics. So I'm just gonna highlight this area right here. And then the boils, the furuncles and carbuncles are just like what we saw in Dr. Pimple Popper kind of thing. So they're just giant boils, and they're inflammations of the hair follicle. So F for follicle, like this one. And they're skin abscesses. So they're just a skin abscess. If somebody ever says they have an abscess, that's what it's technically called. It's called a furuncle or boil. Honestly, I never use that term, so don't worry too much about memorizing that into your long-term memory. Just remember, skin abscesses are inflammation of hair follicles, and it's usually staph. So staph causes all of these. And they have like a deep, firm, red, painful nodule. Remember, a nodule was bigger than the 5 centimeter for your papule. So a papule and a nodule are exactly the same thing except bigger. So a nodule is large, and it feels like a tender cyst nodule, and they can also have cellulitis. So somebody can have skin abscess and cellulitis. The only difference though is, remember here I said that you can have intact skin. With the skin abscess, this boil does need to be drained. It does fill with pus. So that one does have to be drained. The only way to treat this, a skin abscess, is to drain it. In some cases where it's extensive, the patient might go into surgery and have what's called an IND, which is incision and drainage. So they might go into surgery under general anesthesia, and the reason why they do that is because they also debride the wound. This is necrotic tissue. So they have a really large skin abscess. They can have general anesthesia. They drain it. They cut out the nodule, right? Remove the pus. They remove all necrotic tissue, and then they're able to stage it. Because sometimes they have a huge abscess with some necrotic tissue, but underneath it, you can't quite tell, how extensive the infection is. And this patient, if it requires surgery, would require IV antibiotics. But these can also be done in clinics. So you, within your scope as an LVN, will probably be assisting with these at some point in your career if you work in a clinic. They go into the clinic, they use some lidocaine to numb the area, they slice it open, drain it, pack it, like you do wet to moist dressings. They pack it, and they usually come into the clinic daily for wound care. So you'll have these patients coming in daily that has a skin abscess that's getting packed and redressed every day. That's very common. This is the same thing, except you have multiple boils. So nothing interesting. Same concept. It can drain on its own, and abscesses can all cause systemic infection. All abscesses can cause systemic infection. So like I said, these are staph normally, but they can all be MRSA, all of them. So usually whenever you're draining this pus here, they're usually culturing it to see what kind of bacteria it is. And then they're treating the patient with antibiotics. The bacteria can travel through the dermal layer to the bone, causing like your osteomyelitis, which is severe and bad, or it can cause sepsis. So all of these can progress to worse. So here's that after incision and drainage. Okay, so here's your nursing care. Moving on, herpes virus. I'm not going to talk too much about these. Like I mentioned, the biggest concern is only like if it got on the eyes or somewhere else. Cold sores. This is what I told you, that it becomes embedded in the nerve ganglion. So they always comes back at the same time. And this is what triggers it. I hate that this book is like real iffy with what I can highlight. This is, you know what? They do sell a topic, what do you call it? Over-the-counter topical thing for the lips now too. For the, what is it called? You guys know what it's called. They have commercials and stuff about it. Anyways, they have like a chapstick thing. Oh my god, I can't think of it. I can see the image where it's like a picture of a face and it has a little clock thing on it. It's not a clock, but it says it shortens it. But anyways, they do have over-the-counter topical ointment that can be put on the cold sore to minimize it. Oh, here it is, Abreva. So there's that one too. So they can use like a topical or oral cyclovir. Just remember that I mentioned that this one's terrible on the liver. and it is contagious for up to 5 days. But this is not something that you like, don't go to work. It's just, you just are cautious. About what they causes chickenpox and shingles. So this one's going to be high risk for immunocompromised. Oh wait, this is chickenpox. We're still talking about just chickenpox. I'm not going to highlight that then. Wait, are we talking about? Oh yeah, it's talking about both. Never mind. So this is talking about the varicella vaccine. We're not talking about kids, so I'm skipping over that. We're talking about shingles in adults. It doesn't really give you too much. Maybe it's down here. I'll keep looking for it. Okay, so this one right here for the shingles, they usually this is usually how you know it's shingles. They're on the trunk and spread halfway around the body. So that's usually how you know they have shingles, because it's usually on their body, like this. And it's in like a linear pattern. I have seen shingles like this, and I have seen it also spread around to the breast. I saw in a female patient where it started right here, like kind of like under the armpit, and it wrapped around on top of the breast. Okay. So just remember, this one is usually on the trunk. And then this is, I've seen this on tests before, that a pregnant patient cannot take care of. This question you get as a not a delegation, but as a leadership question. So you get like, oh, you're the charge nurse, and you're assigning like CNAs to care for patients, blah blah blah, and basically you don't want to assign a pregnant person to take care of anybody who has chickenpox or shingles. And then remember I told you that I'm gonna highlight this here too. It usually only affects one side of the body because it's the nerve, and you have bilateral nerves, right? So you have nerve for the left side, nerve for the right side. So usually only affects one side. And then this is a part that I was telling you about the pain. So I'm gonna highlight this whole section on pain. This is like a big deal. So when you get questions about shingles, one, they're usually in airborne precautions initially while the lesions are while they have vesicles, while there's fluid in them. So they're usually in airborne precautions initially, and once the lesions have scabbed over, they're usually like in contact. So you usually get a bunch of infection control type questions. The second type of question you get about shingles is pregnant people. They just can't be in there. And the third important thing about shingles is pain. The pain is severe. This is a one that comes up sometimes, that medication. Nobody gets medications. And then the oral, same thing they use for regular herpes. Can help too. Oh, and then gabapentin helps a lot with it. They call it post-herpetic neuralgia. So it's nerve pain. Yeah, so here's a complication that can happen. All right, so I don't know about that. Fungal infections. not going to go too much about this one either, because I feel like this one's a little bit more common, and people kind of know about these a little bit more. We talked about this one already, older adults, because their nails are real thick. So here's the care. Our elderly patients, not elderly, but our over 65, should be getting their nails clipped by podiatrists, because in the process of cutting their nails, they're so thick, they can pull on the skin, and those breaks in the skin is what allows that fungal infection to take over. And then this is, they can use tea tree oil daily. And then there's also application of the Vicks twice a day. So both of those help. The reason why is because antifungal medication are also extremely, well, it's the same medication. It's like similar to your antivirals. They're also extremely harsh on the liver. So we don't want to give somebody who has, you know, a bunch of other health conditions something that's going to damage the liver. So let me find it here. See? Liver function should be monitored during administration. So it's like really bad. And if anybody has elevated liver enzymes, they cannot take this medication, the antifungal. It's an oral medication they take every day for 6 months to a year. I'm just going to highlight this, but I'm not going to go over it. But basically, fungus live in moist areas, which is why socks and feet care is important, along with fungus being on surfaces. So this is athlete's foot, same thing, funguses. Just instead of being in the nail, it's on the between the toes. And then this is where you get it from. Swimming pools, spas, showers, public facilities, where your feet are touching the ground and cracks and all that. So people should that have any risk for this, which is people who basically anybody. And this is what I've been told from other healthcare professionals, like you should never be wearing like socks in your house. So you should be wearing clean cotton socks every day, And once you're home, you should be taking your socks off and letting your feet get air. Because if you look up here, what was it? Oh, right here. So treatment means keeping the area dry, clean, and exposed to air and sunlight as much as possible. So that's also preventive. And you can see that up here. Wear shoes that provide ventilation, wear cotton socks if you're wearing, sneakers. Wash the feet daily, make sure it's drying between the toes, etc. So basically letting your feet get exposure to air helps. This is the same thing that was in that list. So we know that it's caused by public places. So making sure you have like if you use a gym shower basically, or you go to a hotel and you're using like the swimming pool there or the fitness center and all that. And then this is a licensed scabies. You only need to know the treatment for these, which is specific. Oh, this is important. So the scabies burrow. Okay, so scabies are not visible on the outside of the body, but what you're looking for is burrowing. So because they burrow between the fingers and the toes and the groin, wherever you see rashes, you're looking for lines. So basically the mite goes under the skin, but it does come out of the skin like at night. So usually the people complain of the itching that's more severe at night when they're sleeping or when they're waking up. And they have intense itching because excretions means peeing and pooping type, right? So these mites come out and they're peeing and pooping and they're itching and causing blistering. I know it sounds gross, but whatever. And the diagnosis for this one is skin scraping. But I will tell you that nobody does that. Most of the time people are just treated based on what they look like. And then this is important for you to know. Wait, this is just for lice. Hold on. Okay, so what they use is this permethrin, but it's not giving the information about how to use it for the body. Once again, remember any weird rashes, right? Contact precautions. You sometimes get questions about this, about it. So anything that can't be washed is usually put outside in the sun. Bedding, all that, you're supposed to put in like a trash bag and put it out in the sun. And then for laundry, hot water on the hottest cycle, dry cleaning whatever you can, spraying disinfectant on the other stuff, hot brushes in the hot water for 5 minutes. Oh, here it is, for items that cannot be cleaned. So that works. And then skin cancer. Skin cancer is another one that I'm not going to go too deep into. So it's not going to be super NCLEX. Like I said, just remember the risk factors. Sorry for my background noise. I might just move right now. And then of course, okay, so signs and symptoms. There's different types. So this is a basal cell. This is one that's harder to catch. So this is a big red flag for skin cancer. Any scab or sore that you've had for more than a month. And it could be in the ear, it could be anywhere. You're being loud. My mom's being loud. In our own house, I'm telling her to be quiet. All right, malignant melanoma. This is like, we have this in just pressure sores. I think I'm gonna say pressure sore for burns, good wound care. So skin cancer, skin cancer. Let's see. This is the least common form, but it's the most fatal. So between the two, you don't want this one. This one's bad. Not as common, but it's super bad. And then here's a chart. I'm almost done. I'm not gonna go too much into this, honestly, guys. We all know chemotherapy, radiation is the answer for all. This one does have something specific to it, though. This is to prevent melanoma from becoming systemic cancer. All right, so let me let Ms. Fernandez know that. Is she on? No, huh? I'll let her know that we're ready. The next test isn't until we cover burns. So I'm going to cover this next Monday. I'll cover the pressure source because that one's actually important. So everything I kind of skimmed over today is important for you to know, right? But it's a little bit more basic. Pressure sores you will absolutely be dealing with. If you work in a nursing home, a clinic, a hospital, you'll absolutely be dealing with pressure sores. And these are staged. If you look, which is fasted. Oh, no, fasted exudate. That's burns. But anyways, they're staged very similar to burns, so I feel like this lecture will go very well when we talk about burns. The only difference is that this is caused from immobility, and of course burns are not. So, sorry, I'm not covering too much on skin cancer. For skin cancer, basically sun, right? UV radiation, tanning beds. Signs and symptoms are abnormal lesions on the skin. So basal cell carcinoma is like a small, scaly area, and it doesn't get large until it's spread really fast. And the big red flag for skin cancer is a sore that hasn't healed in a month. That could always be basal cell carcinoma. So that would be squamous cell is A, basal cell is B. See how that's not too obvious? Then melanoma is like this, those are the darker lesions. And then this one here, Kaposi sarcoma is HIV patient, so don't worry too much about that one. It's just categorized as a skin cancer, so it's here. Where's squamous cell then? So this is basal cell, 3 types. Basal cell. Oh, I skipped it. So basal cell appears on the head and neck most frequently. And it's a small nodule that becomes ulcerated. Remember that the other one doesn't become ulcerated until it's been there for a long time, or it becomes larger. So basal cell carcinoma is small, scaly area that grows. Squamous cell is a small nodule that becomes ulcerated, right? And melanoma, which is the least common kind, and it's a pigment forming one. So this one's usually darker. So superficial spreading nodular tico. So this spread. And honestly, skin cancer is very easily, not easily, but it's a lot more easier to manage because these lesions just have to be cut out. Like they're on the surface of the body, if that makes sense. So this is like, it's not showing how big it is, but let's say it's like 5 centimeters, you know? So you just like literally, they just, in the office, lidocaine, cut it out, put a few stitches. And then they scoop too. So they scoop the underlying tissue with like a spoon licking tool, and they cut and scoop what's underneath it. So they do leave obviously a crevice. It's not like they're leaving like a beautiful incision. They do scoop and remove what's under it. But if you think about it, these are all on the surface, so they're a lot easier to treat, manage, identify. They don't have to do like scans or anything to find it. They just look and they're like, that looks suspicious. Let's remove it and biopsy it. So they remove it, they send it away for biopsy, and then they're like, oh, it's cancer or it's not. That's the extent of these. So they're a little bit more simple treatment-wise. Oftentimes the patients will still do chemotherapy because remember, all cancers can metastasize. So the cancer can travel from here into the lymphatic system and metastasize. So they can still metastasize, but if they're caught early on, they're treated very easily. Like, I will say though, in some severe cases of like the melanomas or some of the ones that become more invasive. So like if this was really invasive, they would have to like remove the ear, remove a piece of the nose, remove a piece of the cheek, which includes muscle and skin, right? So in some severe cases where the cancer is more spread, they will obviously cause some surgery that can cause deformities. Therefore, we still have to address that psychosocial part in some patients. But for the most part, these are topical. They use cryotherapy, chemotherapy. They can do radiation aimed at just that area. But you know, they're rarely spread, easily treated. This one does spread a little bit more rapidly. rare type, relatively rare, and then yeah. And like I said, all cancers are treated the same: chemotherapy, radiation. So this is the one that I was telling you about, the melanoma, that it does require removal of adjacent structures. So like I said, if they have melanoma on their ear, nose, face, it could require removal of those things. So usually they don't do radiation, but definitely they can do chemotherapy if they feel like it's metastasized. But skin cancer is one of those that they cure you by just removing the lesion. So that oftentimes, like 90% of the time, the patient's going to go get the lesion removed and they're cured. And that's it, done. No radiation, no chemotherapy for like 90% of the patients. And then they might get some of this like interferon or some other medications. Like these medications down here can be used, but they don't have to go through like the whole extensive treatment that regular cancer patients go through. So see right here, what says that? Simple treatment, simple surgeries. In the office, they get the tumor removed, sent off for biopsy, etc. So your focus on skin cancer will be just education. All right, so let me text her that we're ready.